Hello guys, what's up? Welcome back to Ivy and Skin. It's so good to be back. Thank you guys for tuning in. To all my lovers, subscribers, old and new, you guys are awesome. You guys are welcome. But if you're here to subscribe, please kindly just click on the subscription button and the notification bell so you get notified whenever I post a new video. Today I want to talk about retinol and retinoid. What's the difference? It's confusing, right? Trust me. Once upon a time, I was confused myself. What is retinol? What is retinoid? What is the difference? And then we'll talk about what is tretinoid. So you guys stay tuned and I'm going to break them down for you one by one to the best of my ability so you can understand as well. Okay? So let's get straight into it. So retinol is derived from vitamin A, and that is retinol. Okay, I'm going to spell it on the screen so you can understand better because retinol, retinoid, they sound alike. Okay, so retinol is derived from vitamin A, and it's mainly used to treat mature skin, to remove wrinkles, to treat acne and acne scars, mature skin, and is used to shrink pores and some other stuff as well. Mainly it is used, and it has a downside, it has a disadvantages as well. And the downside is it can peel your skin, it can irritate your skin, it can even make your acne worse, and it's not meant for every skin type. There are certain skin types that is meant for. Not every skin type can use it. So what does it treat? Acne, wrinkles, mature skin, shrink pores, anti-aging. So not everybody can use retinol, and most of the after effect, side effects of retinol may include swelling, blisters on your face, peeling of your skin, and redness, itchiness, and it will create a sensitivity. It will make your face to be more sensitive to sun, to UV rays. You can easily get sun damages on your skin when you use retinol, and because retinol actually treats sunburns. Honestly, it does, but your skin will be sensitive to the sun. So that is why his best advice that you use retinol only at night. And if you're your first time using retinol, it's advised that you use it a low percentage, say 0.05. And even at that, you can't apply it every night. You have to apply it like twice a week. You start with that. If you do that for 2 weeks and you don't see any reaction, any of these side effects I mentioned, then you can increase it to 3 nights in a week. And gradually, just like that, you can increase it and you will get the best result from it. So, what's the difference between retinol and retinoid? Now, this is the take here. Retinol is just retinol. It's not like, it's just retinol. It's just a single ingredient. Whereas retinoid is a compound of several ingredients. Tretinoid is inside retinoid. Retin A is the same thing as tretinoid. So tretinoid is inside retinoid. I'm going to put a list of them. They're just a compound, like a family or group of ingredients. That is what make retinoid. And retinoid is considered a synthetic version of retinol. Okay, retinoid is considered a synthetic version of retinol because, like you see, retinol is just one ingredient. It's just the natural ingredient retinol that was derived from vitamin A. Whereas retinoid is a compound of several ingredients put together, which I'm going to name those ingredients for you so you can understand them better. So if you're looking at a product and you're looking at the ingredient, so you can identify some of this ingredient there. The reason I'm making this video is make you understand further, because some creams you might buy, especially face cream, more face cream, you might get some reaction and not know why your face is reacting to this cream. It might be one of these retinoids ingredients that is in that cream, or retinol. And like I say, if you're using it for the first time, you don't use it every day. You don't put it on the daytime when you're going out, especially without sunscreen. Even if you're putting sunscreen, you cannot apply retinol and go out. It will make your skin to be more susceptible to sunburns, sun sensitivity. So that's why when you apply creams and you see, oh, I'm getting burns, oh, my face is reacting, it might be retinol. And maybe because you're using that cream every day, that's why it's reacting. Like I said, if you're starting to use retinol or retinoid for the first time, you have to start gradually. You have to build it. You start by doing it twice a week, only at night. Then gradually increase it to 3 times a week, then 4 times a week, till your skin absorbs and accepts it and balances with it. So, like I said, the difference between retinol and retinoid is that retinol is just a single ingredient in its natural form derived from vitamin A, whereas retinoid is a compound of several ingredients compounded into one. And tretinoid is in retinoid. Retin A and tretinoid are the same thing in retinoid. I'm going to put on some lists and so you can understand more better, just in case you don't understand my explanation. Okay, so gradually I'll explain more. Then another thing about retinoid is that retinoid comes in 2 forms. Retinoid, I'm talking about retinoid here. Retinoid comes in 2 forms. It has the topical, which you apply outside the skin, and it has the oral form, which you can take. Look, like I said, it's a compound of several ingredients together, unlike retinol, which is just to apply it. Jeez, I have a mosquito bite here. Which is just to apply it topical, that's it. But retinoid has the oral version in a pill form and the topical version. And retinoid in general is considered a drug. It's considered a drug because it's the synthetic version of retinoid, and they put too many things together, so it's like stronger. It's like a stronger version of retinol. So it comes in 2 forms, oral and so what does retinoid do? Some of the benefits of retinoid, the topical one is it reduces inflammation, it treats hyperpigmentation, it regulates cell turnover and help increase the reproduction of collagen for anti-aging skin. These are just some of the benefits. Whereas the topical version, It helps with unclogging. There's a certain kind of antibiotic inside the retinoid that you take. The oral version that you take. When you take it, it helps kill those bacteria that form acne. That's why you see some acne. You're being prescribed some medication, not just rub this, rub that. They prescribe. I actually prescribe some antibiotics and retinoid product for my clients, because some antibiotics are bacteria infections. So you need to prescribe some retinoid prescription, and it kills those bacteria that form acne from within, from underneath. And it helps with skin aging, it helps with pigment condition, sunburn, and the oral tablet helps, treat certain types of cancer. Certain types, not all of it, certain types, I think, like skin cancer at the early stages, and other forms of cancer as well. And basically, and it helps treat psoriasis as well on the skin, eczema, dermatitis. So honestly, retinoid is, for me, it's just a stronger version, and I will not suggest that anybody just go for retinoid without prescription. It's not advised to go for retinoid without a prescription from a professional dermatologist or a skin therapist. That's just the reason why, as a certified skin therapist, I would advise that if you must use retinoid, stick to the topical. If you're going for the OTC, so like over the counter, you're not going for prescription retinoid, stick to topical and use it the same way as retinol, bit by bit, gradually. Okay, for me, taking a topical retinoid requires a prescription from a professional dermatologist, and this is the reason why. Let me read from an article. There's some really adverse, like additional reaction here that you can get from taking oral retinoid. Some potential risks, and involves mental health condition, muscle, joint, and bone pain, headaches, loss of night vision, abdominal pain, nausea, and diarrhea. Now, this is not for everybody. It might just be allergy. You just never know. So that is why, all in all, never just go buy an oral retinoid and take without consultation or prescription from a professional dermatologist. So except you're being prescribed retinoid, then yes, they will give you the specific one for your specific problem. All in all, stick to the topical. Please don't go for the oral without. So I hope I managed to clear some confusion here. Then again, there's Tretinoid, that people know, that most people, I've seen some formulators on YouTube say use Tretinoid. Yes, I have also prescribed Tretinoid depending on your problem. Tretinoid is the same thing as Retin A. So if you're going to OTC, like over the top counter, to buy Retin A, Tretinoid are the same thing, and they are one of the group of ingredient that is inside retinoid. So you get, it's just one of it. It's not like it's the entire retinoid. So if you're buying a product that contains retinoid, know that retinoid is a group of ingredients that includes tretinoid, that includes, I will give a list of that. So there are a group of ingredients in it. Then if you're going for retinol, it's just a single ingredient. Okay, now if you apply retinol or retinoid itself, both of them, they have similar way they work. If you apply it, for instance, you will notice that your skin might not, how will I say, like rough at first, or If you have acne, you notice the acne might look as if it's getting worse. Now that is the called in Skin 101, that is called purging. Your skin is purging. It's like how would I say it? It's like you take you're having a stomach upset and you drink something or eat something to flush out the bacteria from your system, and you're gonna be having a runny, visiting the toilet, and your everything will be clearing out. So that is how they work. So if you have acne and you see that you apply it and it looks as if more is coming out, that is just called purging, and it will not last for too long. But if it lasts for as long as it lasts, as much as the bacteria you have inside your face. If it lasts 2 days, 2 weeks, that means there's 2 days little bacteria in your face, 2 weeks tons of bacteria in your face. So just be patient with retinol and retinoid. It's not a product that you use and you expect to like, ooh, result now. Let me tell you one small experience I had with a client. I had this client, actually, I think the fiance, the fiance called and booked an appointment on her behalf. And he sent me a picture and asking me, they had a wedding coming up about 3 months time. So she doesn't base in Port Harcourt. He bases in Port Harcourt. She doesn't, so she doesn't know where around. So he called into and he sent me a picture. It was really high, so like some are black, some were coming out, new ones, old ones, leftovers, peeled ones. It was a big mess. Poor girl. And he sent me a picture and asked if I could, and I said, that's my office. Yeah, send her in. So he booked an appointment for her and she came in. I did a skin patch test and I looked into it. I used my microscopic camera and I looked deep down into her skin, the first layer, second layer, and the third layer. And I told her, I said, look, I'm going to prescribe some medication for you, which was retinoid. Oral, I prescribed for her. Then I say, for the surface, I'm going to give you a chemical peel, because their dried up acne left a lot of dead skin that were there, and those dead skin, if they don't go out, whatever product she's using cannot penetrate. And now we cannot just give her exfoliation, because if we now exfoliate the face but with a scrub, it's going to open the surfaces of those new acne that was just coming. So we needed to do something mild, like a mild peel for her. So I gave her a mild peeling and gave her some products, because after you do your facial, I give you aftercare product, especially with peeling. So I gave her some aftercare product to take home. And the next day, which was barely 24 hours, she called me and said she's not seeing any difference. And I'm like, madam, I didn't tell you it's a miracle. Then the second day she called again, she still is not seeing any difference. I said, I don't understand. Please, did this acne pop up in 2 days? Why would you think they'll go away in 2 days? And honestly, to tell you, long story short, this girl gave me hell. Like, no, I've not seen any result. She will call like 9 o'clock, no result. She will call 12 o'clock, no result. And I said, madam, what do you want? And she was like, you have to give me a friend. I said, no problem. Send me your account number. And I sent the money back to her. My product, everything. I said, just take and go. Funny enough, she called me back 2 months later and said she's really sorry. Look at her face. That she sent a picture. And she's so grateful. She's sorry that she doubted me. Sorry, dear. I did not even respond. I didn't bother, because I've sent you back your money, and that for me, that is the end of the deal. I have no business with you anymore. And that was it. So patience when working with retinol and retinoid. It will do the job. Trust me, it will. Just be. So with that said, I hope I managed to give a clear explanation as to what retinol, retinoid is, tretinoid is, retin A is. I hope. But if you're having any problem still understanding, send me a message in the comment section or send it to my DM on Instagram and I'll answer your question. Guys, I'm here because of you. Without you, there's no channel here. It doesn't exist. So send in your questions and I'll answer you right away. Thank you guys for tuning in. Please kindly subscribe and click the notification bell once more so you don't miss out whenever I post video. See you soon in my next video.